Yeah, here they are. I only got the tops. I'm going to tell you a few things I liked about these teeth, and I'm going to tell you a few things I didn't like. One of the things I would like to speak about would be cost, and we'll get to that a little later. I've had my implants about 4.5 months, and number 6, one of the bad things was speaking. It takes a minute, to get things adjusted so that your tongue gets used to the new teeth so that you can now speak once again freely and clearly. So, give it a chance, take your time, and just realize that there's going to be a little bit of slurring at first. I am 4 months and about 3 weeks in, and I would say I'm speaking fairly well. Number 5, one of the good things was that I started thinking about my health about 20 years ago. I went in one day and it was done the next day. How amazing is that? And I got these teeth and it's a success. Not only is my health better, but I'm easier to look at too. Number 4, one of the bads was flossing. It's not just like flossing the rest of your teeth where you just get the floss and you put it up in there. You gotta actually get the little thing and you gotta put it up under your gums and then clean out in between each stud. Now I did notice when they removed my teeth that I wasn't doing a really good job on the front 2 studs. They're really close together in my mouth. So it's a spot about that wide. And so I was missing that spot. Sometimes you could tell from when they took them out to clean them. So I'm focusing a little more on getting that spot so I don't have yuck breath, because we don't want yuck breath. So when you're flossing, make sure you get in between all of the studs. I got 4 on mine. Sometimes it's a 6-in-1, sometimes a 4-in-1. So I got the 4-in-1, and I have to be conscious to get all 3 areas. So yeah, be careful when you're flossing that you be sure and get all 3 areas. Number 3, one of the goods was cost. Nuvia has smile coordinators which help with the financing. They get it all hooked up for you and it's a simple process. And then if you're used to just paying your bills every month, it's a simple process. They can even make it direct deposit. My smile coordinator was OJ, and he was really helpful. And, OJ's not just about the business. OJ's a pretty personal guy, man. He cares about what he does, and he enjoys life. And we talked about some cool stuff. And, OJ got it working just perfect. It's within my budget. I got the teeth I wanted, and OJ didn't make it sound scary. He was a very good smile coordinator. And if you're worried about the cost, don't be. We're gonna leave a cost guide down below so that you can get a good idea before you even go in and see OJ or one of our other smile coordinators. Number 2, the last bad is pain. I had less pain from the Nuvia procedure than I had when I got 1 root canal. And I have a problem with pain. I'm in pain all the time, every day, and I have a huge high tolerance to pain. I would say the pain was there 7 to 10 days, overwhelmingly, and then after that it was just a mild toothache per se. A mild toothache per se in 4 places where the 4 implants are. After 10 days, very mild. After that, went away. And number 1, which happens to be the last one of the 6, but the best one, is you go in to get the work done, and the next day you leave with these beautiful teeth. How can you beat that? if you like eating steak and beef jerky and you know, wonderful fish. Shrimp are even too hard to cut with a plastic fork. I checked it out. So now I can even eat shrimp. By the day, my words are coming out clearer. Now I can eat whatever I want because we're past the doctor's visit at the 4-month period. Just in case you're not aware, you can't cut shrimp with a plastic fork. So as you can imagine, after not having any shrimp for 4.5 months, these fajitas are sounding good. Shrimp. Some people are concerned about the gap in between your teeth and your gums, and I'd never heard about a gap before I got my teeth. And now that I have them, there's no problem with the gap. Okay, I got a good comparison for you. I had a bridge done, and so I had to floss under my bridge. And the bridge gap was way bigger than any gap that I have now. My gums seem to have grown up and filled in everything just so beautifully that it's comfortable. It's not even uncomfortable. You know, I even forget the teeth are there until I go to put my night guard in. When I put my night guard in, that's when I remember I have Nuvia teeth. Other than that, I remember when I'm flossing them or when I'm cleaning them, but it's just so natural now. Everything is just like natural teeth. It's really nice. Just instead of flossing between the teeth, you floss above the teeth. So you gotta kind of go across, you know, you still get a little back and forth action, but it's going across as you're doing it. And don't forget to get the small gap if you have a small gap. I got a small gap about that big. Don't forget to get that. When they took the teeth out after the 4 months for the examination, I could see that I was missing the small gap a little bit with my flossing. So be sure and get that spot. You don't want yuck mouth. What's really important is our health. And if you can get new teeth, and it won't only show that you're healthy, it will show that you care about yourself. And before I quit drinking alcohol and doing other drugs, I didn't care about myself. I only cared about the party. The party had to stop before I could become an adult and straighten out my financial situation enough to where I could be put in this position to have teeth. And I don't feel like my material things are what's important in this situation. And I do have some nice material stuff. However, that's not the importance here. The important thing here is my health.